Hello everyone, greetings. I'm Dr. Varun Agarwal, consultant urologist. Today I'm going to speak to you about benign enlargement of prostate, that is BPH. Now, what exactly is a prostate? It is a small walnut-sized gland which is a part of the male reproductive system of normal size of 18 to 25 grams. Its main function is production of fluid which forms a part of the semen. It actually surrounds the tube called urethra, which carries urine to the exterior from the urinary bladder. So, when it enlarges in size, it compresses on this tube and causes urinary symptoms. Now, what is BPH exactly? It is a non cancerous growth of the prostate which normally occurs with growing age. How does it occur? The main causative factor is actually the hormone testosterone, which is also called dihydrotestosterone. After 40 years of age, the prostate grows bigger in size due to this hormone. As I said earlier, that a tube called urethra goes through the prostate, and as the prostate enlarges, it compresses on this tube, causing urinary symptoms. Now, how does a patient of BPH present himself with? He mainly has lower urinary tract symptoms, that is, symptoms of the lower part of the urinary tract. These can be of two types, irritative or obstructive symptoms. The irritative symptoms include frequency of micturition, urgency, that is, a strong desire to pass urine, or there could be nocturia, that is, he gets up frequently at night to pass urine. There could be obstructive symptoms like poor stream, there could be intermittency or hesitancy, that is, stopping and starting of the stream again and again. There could be terminal dribbling of urine, there could be straining of micturition, or there could be sense of incomplete evacuation. Now, what happens if the disease progresses? There can be worsening of these symptoms, there could be urinary infections, urinary stones, or even kidney damage. In worst come worst scenario, there could be a urinary retention episode wherein the patient will present to an emergency department with inability to pass urine in severe pain when immediately catheterization is necessary. BPH also has impact on the quality of life. That leads to various lifestyle adaptations. Adaptations like what? Like the patient may drink less amount of water for the fear of not being able to pass urine. He may pass urine every time before he leaves home. Wherever he goes, he may look for a toilet first before doing anything else. According to various studies, this BPH is also associated with some amount of sexual dysfunction. Now, how do we diagnose BPH? It's simple. The most common way of diagnosing are the patient symptoms. The patient symptom score is called an IPSS score, which is measured, by which we doctors usually diagnose BPH. Other methods are a digital rectal examination, that is a finger test that a doctor does to assess the size of the prostate. There can be ultrasound of the abdomen and kidney urinary bladder, which shows the size of the prostate. We could also do a uroflowmetry, which is a simple test which measures the flow of the urine. Another test which is frequently done nowadays is the serum PSA. That is, it's a simple blood test which is a pointer towards the presence of cancer in the prostate. Now, once you're diagnosed by it, what are the various treatments of BPH? There can be medical treatment by medications or surgical treatments with the help of a surgery. Various medications are available in the market like tamsulosin, alfuzosin, terazosin, silodosin, vindoxazosin. They are available by different names. Now, how do these medications help? They increase the urinary flow, they improve the quality of life in BPH patients with minimal side effects. They are very well tolerated even by the elderly patients who are on various medications for heart, diabetes, etc. Now, how do you take these medications? Just a single tablet has to be taken at bedtime, after food, at the same time of the day, preferably every day. Now, what are the common side effects? Very occasionally, patients may complain of dizziness while getting up from the sitting position, or there could be rhinitis, that is, runny nose, slight headache, or in extremely rare situations, there could be hypotension. Again, these symptoms are not really very common. Now, this was all about the medications. What about surgery? When does a doctor decide to do surgery in a patient of BPH? The most common indication for surgery is that these medications are not helping. When they do not help, we have to resort to surgery. Other indications are presence of recurrent urinary infections, presence of stones, if the kidney function is affected or there's blood in the urine, And also, if the patient suffers an acute retention of urine where he presents with pain, these would be the indications to perform a surgery. Now, what kind of surgery do we do? In this modern era, we normally go for an extremely minimally invasive technique which is called TURP, transurethral resection of the prostate. It is done for small to medium sized prostates, and it is a minimally invasive procedure which has no cut or scar on the body. It has high success rates, lower costs, and shorter recovery times. Other treatments have been described for larger sized prostates, which include bipolar TURP or HOLEP, that is Holmium laser enucleation of prostate, or open prostatectomy, that is done with the help of a big incision on the abdomen. This was all about BPH. In a nutshell, I would like to say that BPH is an extremely common thing affecting men above 40. Almost every man, is affected by it at some point. However, it is very much treatable with the help of medications. If the medications fail, even the surgery that is done is actually a very minimally invasive one. So if you have any symptoms, please do not hesitate to contact or see your nearest urologist. Do not wait for it to progress. Lastly, I would like to say that in this pandemic, please be safe, wear mask, wear gloves and sanitize your hands regularly, maintain social distancing, and if possible, take the vaccine. Please be safe. Thank you.